All right, we're moving on to some of the external anatomy of the male reproductive system. The penis, basically, this is the organ that's going to introduce semen into the vagina and carry urine out of the body. So remember, the penis has two jobs as well as the urethra in males. There are three regions. There's the root. The root of the penis is, let's go back, a fixed portion. It attaches to it attaches the penis to the rami. Oh, hold on a quick second here. I'm trying to get my pointer going so I can have a pen again. Attaches the penis to the rami of the ischia. So that's at the very base of the penis. There's the body or the shaft. This is the movable portion. This is what contains the erectile tissue that allows the penis to change orientation for fertilization. And then there's the glans penis, the distal end of the penis, and this surrounds the urethral orifice. Now the skin around the penis is itself generally hairless for the most part. It is more darkly pigmented than skin elsewhere on the body. That's just one of the characteristics of reproductive tissues, or external characteristics. The prepuce is the foreskin, and so this is the skin that surrounds the tip of the penis. This is the portion that may be removed during circumcision, and it attaches the neck of the penis and continues over the glans. So in our figure here, what we're looking at is, first let's start with the bones. Here's the pubic symphysis right here, the connective tissue attaching each component of the, not pectoral girdle, the pubic girdle. The urethra, you'll see the urethra coming down here, the membranous urethra. Here's the bulb of the penis down way at the base. Here is the crus of the penis, which is a part of the base. The body of the penis, which is the long shaft of the penis. There are two layers, I guess you would say, of erectile tissue, the corpus spongiosum, which is on the underside of the penis, and the corpora cavernosum, which is on the top of the penis, so the dorsal surface of the penis. And then we have the scrotum down underneath. The glans of the penis is the region here at the very tip, and then we have the external urethral orifice, or opening. So the internal structure of the penis, like I mentioned, there are two masses or layers of erectile tissue, the dorsolateral, the two corpora cavernosa, and the one corpus spongiosum is mid-ventral, so it's underneath the ventral surface of the penis. And the urethra passes through the corpus spongiosum, and I'll show you that in a few minutes. The erectile tissue itself, the corpora cavernosum and corpus spongiosum, is basically a bunch of vascular channels that contain lots of connective tissue and smooth muscle fibers and arterial branches of the circulatory system. And so under parasympathetic stimulation, all right, so not sympathetic, not freak out, not fight or flight, under rest and digest, stimulation will cause these blood vessels to dilate, to increase blood flow to the region. The channels then become engorged with blood and the penis can become erect. So if we look at a frontal section of the penis and how it's associated with the testes, let's start way down here at the testes. All right, so the testes are down here with the epididymis leading up through the ductus deferens, up and over through the seminiferous tubules, down through the opening of the ejaculatory duct. Here's the prostate gland right here. The bulbourethral glands right here. Here is the inguinal diaphragm. So it's a layer of tissue, inguinal tissue, that allows the membranous urethra to pass through into the penis. Here's the opening of the bulbourethral glands. So here are the glands here emptying into the urinary tract. Right here we have the corpus spongiosum, the two layers, and then the corpus cavernosum adjacent there. And if we take a cross section through here, this is one of the this is an interesting orientation because this allows us to see the corpus spongiosum ventrally to the corpus cavernosum. So here are the two sides of the corpus cavernosum. Each one has an artery, of course, so that blood can travel into there for erectile function to occur. We have dorsal nerves and blood vessels here. And in the middle of all this, which we're not showing here, is the urethra, which is going to be carrying urine or semen for fertilization. So how does that happen? So semen release is actually called emission, okay? So after the erection has occurred, the semen is released into two steps. The emission portion, which is under sympathetic control, so remember parasympathetic. This parasympathetic activation coordinates the peristaltic contractions that starts activating the accessory glands. This is going to mix the semen, the fluids, with other components of the semen. And then eventually ejaculation is the secondary phase of semen release. And this is a powerful rhythmic contraction of the floors of the muscles in the pelvic floor. And these contractions are going to be projecting the semen into the vaginal opening, or into the vaginal space, so that the semen can eventually be transported up into the uterus and up into the oviducts, where fertilization usually happens. All right, so that is the end of the male reproductive system. We are going to cover the female reproductive system in a separate lecture.